Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional endocrinologist based out of Oklahoma City. Thank you for joining us this week. We appreciate you taking time out of your busy life to learn something that might help further your health or your education. This week, we're going to be focused on nutrition. So I have an RD, or registered dietitian. Her name is Tamar, and she's the co-founder of Kalina Health. Today, our episode is going to focus on food as medicine. What type of conditions should we be focusing on that can be treated with food? We're going to be talking about some of the top health myths around nutrition. We're going to talk about protein. How much do you really need? Does that change with age? We're going to talk about carbohydrates and fats. Are they good? Are they bad? Should women eat them? And we're going to talk about some nutrition tips and some common disorders and conditions that patients typically have that follow our show, like PCOS, menopause, hyperthyroidism, and infertility. So make sure that you stay till the very end, because then we're also going to ask our 3 questions. And I'm interested to see what Tamar has to say about the questions we typically ask at the end of the show. So Tamar Samuels is a registered dietitian, nutritionist, and co-founder of Kalina Health. Her unique approach to nutrition care integrates lifestyle medicine and behavioral change techniques pulled from her training in clinical nutrition and coaching science. She's helped countless people transform their relationship with food and their health to improve a variety of health conditions. Tamar has her master's in clinical nutrition from New York University and completed her clinical training at Mount Sinai Hospital in New York City. She's been recognized as one of the top holistic dietitians in New York City by Well Plus Good. So thank you for joining me on this episode.
Thanks for having me, Cassie. So many topics to talk about. Very excited to be here.
Yeah, and I do like the approach that you guys take. So I think with health, it should be a very integrated approach. Obviously, I think nutrition is a huge part of that. But also, you kind of pointed out to me when we were talking right before we started how lifestyle modification and helping people change their behaviors are really important. I think that's one of the main reasons that people don't do well with dietary changes, right? We have so many things that we think about food, right? Culturally, and what we do around food as far as like with family members and how we celebrate. And so helping people to figure out how to change some of those behaviors to more positive health promoting behaviors can be one of the biggest challenges probably.
Yeah, absolutely. I think the problem is twofold, right? There is quite a lot of confusion around what to eat, how to eat, when to eat. We almost have this challenge of too much information. People are overwhelmed, and there's a lack of personalization and trust in who's delivering that information and where they're getting that information. So that's problem number 1. And then problem number 2 is, okay, once we figure out what we need to do, we actually have to do it, right? And integrating that is really where the biggest challenge is, because there are so many barriers, from access to food, costs, eggs are $10 right now. So that's really upsetting and challenging. But also relationship with food, stress. We don't just use food in a vacuum, in a silo. Food is such an important part of our lives culturally. It's also a big part of how we cope with difficult emotions, but also happy emotions. It's a big part of our social environment. That's why I love nutrition, because it is so dynamic and complex, and it's ever evolving.
Yeah, I think that's a good point. A lot of people, what I call, they live to eat, and we should be eating to live. And so kind of changing that mindset of like, yes, food is great. It's, it releases dopamine. It makes us happy, but really thinking about like making sure our body has the fuel that it needs to actually function. And I think that's a big part of why so many Americans are sick, right? So we have all these Americans, 93% of people in the United States, adults, are insulin resistant. We have all these people that as they age, they're on more medications. We have children that are getting adult diseases now. And I think a lot of this has to do with our nutrition. And so figuring out how to help people, and I think you made a very good point. Like, it is overwhelming, right? So the information that you can get, if you just doom scroll on social media, I get overwhelmed, and I have
Yeah,
2 board
the doom
certifications.
scrolling.
Yeah, like I mean, I'm board certified by the American Board of Internal Medicine and Diabetes Endocrinology and Metabolism. So I have a metabolism board certification, and I'm like, this is overwhelming to me. So I can only imagine, people are doom scrolling at night. And the sad thing is, that actually people spend about 8 hours a week online looking for medical answers, like looking on WebMD, looking on Chat GPT, just looking for answers for medical conditions, which mean people want to learn, which is great. But then it's to your point, like when you find something, is it reliable? Is it trustworthy? Is it factual? And so that's the overwhelming part to begin with. And then it's like, okay, well, I found this diet that I guess I'm going to do, or this information. Now, how do I actually implement it? So there's layers to it, like you said. And so I think that's where a lot of people human nature is to stop, right? Whenever we're like overwhelmed, or whenever we're just like, that's difficult, human nature is to not do it. And so I think also meeting people where they are and explaining to them, like, this isn't, you're not alone. It's not, you're actually wired to do that. You're wired from a physiologic standpoint and a standpoint to be able to live long term. When things are difficult, you're wired to just kind of like stop and not do that, to preserve your energy. And so helping people figure out how to get the right information and then implement the right information is hard in today's society.
Yeah, it's very hard. And I think, like, traditionally we've blamed the patient within the traditional sort of healthcare approach has been, and not just healthcare, but also media, right? Like, oh, the patient is lazy, or they're, not motivated, or they, don't have a high nutrition IQ. But I think the reality is that this problem of overwhelm and people shutting down and feeling just lost in a sea of misinformation is one of the biggest barriers. And so a big part of my job and the work that we do at Kalina Health is helping to break through that and really empower people to feel like they know what to do to support their health, and then actually do it.
Yeah, I think that's a good approach. And so if you're listening to this podcast, finding someone who can do that, who can help break down some of those barriers and help you coach you through that nutrition aspect is very helpful. We have a nutrition coach at our office as well, and people are always so grateful when they get to talk with her and, be able to throw all those overwhelming feelings at her, let her absorb them, give some information back to them, and then, really dig in. And everyone is individualized. You said that too, like making sure not only you find someone that's trustworthy to get the information from, but somebody that can give you an individualized plan, because what works for me is probably not going to work for you. And what works for me is not going to work, culturally too, right? Like, so I don't eat a lot of ethnical, food. So like, I don't eat a lot of, Hispanic food. I don't eat a lot of rice. I don't eat a lot of Indian food, but like somebody else may. And so figuring out how to make that work with their diet is really important, right? Because you don't want somebody to give up, their culture. So just working with people in little ways like that, I think sometimes we forget that, when you go online and you find an Instagram diet and it says you should eat chicken and rice with dinner every night, and you should eat whatever for breakfast. I mean,
cottage cheese and sausage. I think that was a TikTok thing, and mustard.
Yeah,
There's been a lot of interesting trends lately.
Yeah, and some people, have ethnic foods that they want to eat or they want to incorporate into their diet, and so that's okay. It's just finding the right way to do it, right? So
yeah, absolutely.
What conditions do you think can be cured with nutrition? Are there any that, can't? Like, what is your thought on this? I'm interested, because my thought is like food is medicine, and I think most things can be fixed with nutrition. Maybe not completely cured, but definitely helped or prevented.
Yeah, Cassie, I'm right there with you. So when we think about what role nutrition plays in health, it's foundational. We know that we quite literally are what we eat. Our food contains the macronutrients, protein, carbs, and fats, and micronutrients, vitamins, minerals, antioxidants, other phytonutrients that quite literally become our cells and help to support all of the metabolic processes in the body. So food is really important for our overall health. That said, we also know that a number of different factors, drives, can determine somebody's health outcomes. Some of those factors are also lifestyle related, like stress, physical activity, exposure to toxins. Some factors are also genetic that we might not have as much control over, but that might also be influenced by our lifestyle. Something called epigenetics, where we sort of have these genetic predispositions, and then lifestyle circumstances can kind of turn those genes on or off. And so nutrition is foundational, but it's not so black and white. It's very complex in how much a role nutrition plays in your health, but we know it's a big one. For some people, it may be bigger than others. When it comes to treating disease, we also know that, this food as medicine can be really, really, really powerful, particularly in chronic disease, heart disease, type 2 diabetes, insulin resistance, metabolic syndrome. So these conditions we know have a large genetic component, but even more so a lifestyle component, which is impacted by food, but also can be reversed in some cases by dietary and lifestyle interventions. So it does really depend on the individual, but I've seen and we've seen at Kulina Health in some of the internal research that we've done that we can have a huge impact on reversing prediabetes, for example.
Yeah, I think prediabetes, insulin resistance, PCOS, a lot of these things, huge. And then when you fix someone's weight too, so prediabetes, insulin, diabetes, most of these people are going to have issues with their blood pressure and their cholesterol. So it's kind of like the perfect trio, right? In medicine, we talk about the triad of diabetes, hypertension, and hyperlipidemia or high cholesterol. So high blood sugar, high blood pressure, high cholesterol. And when you fix one of those with weight, you kind of fix them all, which is nice. Yeah. And then what I see as well is a lot of autoimmune conditions like Hashimoto's, which I deal a lot with, premature ovarian failure, or when you go into menopause at an earlier age than would be expected. A lot of these are inflammatory conditions, which can come initially from your diet because you end up with gut issues, right? You end up with leaky gut. You end up with something called small intestinal bacterial overgrowth, where you have bad bacteria outnumbering good bacteria, which causes your gut to then leak things because of these bad toxins that bugs make. And so then you have these little holes in your GI tract. You're leaking all these bad materials and all the food that you eat into your systemic circulation or into your blood, which causes your immune system to make a complex or to kind of become alert and fight these things that are flowing through your body. And then this chronic constant, activation of your immune system causes your body to sometimes attack itself. And so we end up with things like Hashimoto's, and we end up with things like celiac disease, and we end up with things, diabetes, all these things, rheumatoid arthritis, lupus, autism, all these things that are just increasing astronomically. And so when you go back to fixing just your gut and your nutrition, a lot of these things get better. And I mean, we see that too at Modern Endocrine. And I know you said you guys are seeing that. And so you can kind of help change the trajectory of a disease process. You can change, how that disease process is treated and ultimately how that person lives. Because when you stop that inflammation and stop that disease process, that's not only going to affect the quality of their life, but the quantity or how long they live as well. So it's pretty exciting. And it
is.
It's something that, everyone eats, right? Everyone has to eat at some point. And so it's something that everyone can work on too.
Yeah, that's another reason why I love nutrition so much, because we have the ability to have agency over this. Oftentimes when we're managing a chronic health condition, it can feel like we're totally out of control of our bodies. And really working on nutrition and lifestyle can help us feel like we have control back, right? We know that we can make actionable steps that have an impact. I think people struggle though, because nutrition, a lot of the results that we see take time. And when it comes to quote unquote diet, people are used to like really fast, quick results from medications, but also from diets. And that isn't always the case, especially when we're working on chronic conditions like prediabetes, type 2 diabetes, insulin resistance, PCOS, right? Like these we know are conditions that are impacted by inflammation, hormonal imbalance, and it takes some time for these changes that you're making to actually manifest. We have to be patient with our bodies. I always tell my patients, it took you how many years to get to this point, right? You've been working at this disease or condition has manifested over the course of many, many years. We're not going to be able to undo that in a month of work together. So really important to just manage expectations as part of this process. Yes, food and nutrition is really powerful and has a huge impact, but it's not as quick as we're used to with more traditional diets and medication.
Yeah, I think that's a great point. And not only, people are looking for this quick fix as far as actual weight loss, but I like to remind people too, it took you 35, 40, 45, 50 years to develop these crummy habits that you have, and they don't go away overnight either, right? So habits are things that we really have to work on. And then in doing that, like anytime you're wanting to get healthier, you're wanting to do a diet, you're wanting to get better. If you're just focusing on the nutrition aspect and you're not focusing on lifestyle modification and changing habits, you might lose weight and get healthier for a minute, but it's all going to come right back, and probably going to come back with a vengeance and be worse because you're not changing those habits that ultimately, help control what you eat and control when you eat and control what you do. And so it's more of like, that's where, nutrition itself, I mean, it can do a lot, but again, you have to look at somebody holistically as a person. Like, are you sleeping? Are you walking? Are you pooping? Are you, all these things are important.
All of the things. Yeah. They're all connected.
It's not just one thing. And if it was easy, we wouldn't be having this conversation. There wouldn't be 70+% of adults in the United States that are either overweight or obese. I mean, we wouldn't have these medical issues if it was easy. And so I think that's where, again, human nature is wired to, when things are difficult, retreat. Like, that's how we are wired. And so I think it's important for people to understand that. Like, I try to tell patients, it's not necessarily your fault. Like, that is how you are wired. And so it's almost like you have to be different, like go against the norm, go against the gradient to be healthy, especially when it's hard. And the more unhealthy you get, the harder it gets, right? The more disease processes you have, the more diagnoses you have, the more medications you take, the more weight you need to lose, the harder it is. And the more internally your genetics and your body and your physiology is saying, don't do that, it's difficult. And so I think that's what people, need to understand as well.
Yeah, and I think, to sort of like reframe it too, it'll be your most important project, right? If your health is quite literally wealth. If we aren't healthy, if we don't feel well, it impacts every single part of our lives, from our relationships to, our ableness, our ability to kind of get where we want to go. And so it's hard and it takes time, but it's, arguably one of the most important things that you can do for yourself. And so incredibly gratifying, right? Once you really start to get that momentum going, start seeing results, start feeling more in control, and have a better awareness and understanding and take action on what you need to do, then it starts to become empowering and less overwhelming. So a lot of the work that we do is getting people from that point of defeat and overwhelm to empowerment and confidence, right? Because when we have that empowerment, when we feel confident, then it opens up a world of possibility and advocacy, right? I think a lot of folks have struggled navigating their health, and they haven't been able to advocate for themselves within the larger healthcare system because of the many challenges that we face with the healthcare system at large. And so once we become more confident and empowered about how to manage our health, then we can navigate the system that's really, really challenging and get what we need.
Yeah, I would totally agree. So what are kind of come at me with like the top 3 health or nutrition myths that you see right now that you would like to see either change or debunked. And that can be in the news, that can be in social media. But are there 3 things that really like get your blood boiling? Because like when I'm doom scrolling on social media, there are things that people say about hormones or thyroid that just get under my skin. And I'm like visibly angry about it, which is so stupid because it's social. But I'm like, these are things that millions of people are seeing. So what are like 3 things that you think are just awful that probably need to be like squashed?
So this Ozempic trend really needs to go away. Let's not use blended oats and water as a meal replacement for weight loss. While oats are health promoting food, they're great for heart health, they're high in fiber, they're good for digestion, and can be great for weight loss. We don't need to take a health promoting food, turn it into a diet as a way to lose weight, right? Meal diversity is so important for our overall health. And when we limit our foods to just one food, we're missing out on protein, we're missing out on micronutrients. Not only that, it's not super palatable. So I'm sure, a blended oat drink with nothing but water and oats probably doesn't taste super yummy. And it's not sustainable, right? So will you probably lose weight if you have 2 Ozempic concoctions a day for a week? Yeah, I think you will. Will you gain it back once you stop drinking that? 100%. The Ozempic, please go away.
And you'll stop making your hormones because you need fat to make hormones. So you'll stop making your thyroid hormone and your estrogen and your progesterone and your testosterone because there's no fat in oats and water. And you'll just be really cranky and you'll start to lose muscle mass because you have no protein. So that's stupid. Yeah. Okay, what's the next one?
That one
gotta go.
Such a bad one.
That one's gotta
Bye,
go.
Ozempic.
Bye.
Bye. See you never. The next one. Oh my God. The next one, I would say, let's see, what's happening in this space right now. I think people are getting really confused about sort of the anti-diet movement and intuitive eating. And should we just say no diets, no, eat whatever you want. And this is less go away. It's more like, let's do some real talk about what these movements are and what it means. So the anti-diet movement is a really powerful one, sort of approach to thinking about your nutrition outside of dieting, right? Because we know that diet culture is insidious. People have been unsuccessfully yo-yo dieting for decades and really for generations. And so the anti-diet movement really says, screw these diets. They don't work. I'm going to have another approach, which is amazing. We love this, right? Diets don't work. But it's also really important when we're thinking about reframing our relationship with diets and food for us to have an alternative outside of just saying, I'm not going to diet anymore, right? We're going to say goodbye to diets, but we need to have an alternative as part of that. And I think that's a really important caveat that isn't discussed as much because it's not as clickbaity, right? So when you're thinking about ditching the diet, which you 100% should, what is your alternative solution? And the alternative solution is personalized nutrition that supports your mind and your body, right? Where you're establishing a healthy relationship with food. That includes indulgent meals, that includes foods that you really enjoy with family, with friends, social outings. Sometimes it includes alcohol for some people, but also includes health promoting foods that make you physically feel good, right? So I think it's really important to talk about this anti-diet movement in the context of personalized nutrition.
Yeah, and I would also say this movement of like, love yourself, I do want you to love yourself, but these people that love themselves that are 350 pounds and say that that's fine, that is detrimental to your health. And so that's where I'm going to say, yes, love yourself, and, find somebody to help you make yourself healthier. But to your point, like if we're going to ditch diets at 300 plus pounds and say, well, it doesn't matter, I love myself and I love my body how I am, you still need to find somebody to help you make sure that your body and yourself make it another 5 years. Because when we're severely overweight, that puts a lot of strain on our body. And so that's something that bothers me with this cultural, like, no diet thing as well. I'm totally with you. I don't diet. I do more of an intuitive eating. I eat what makes me feel good or what fuels my body. I think that restrictive eating and dieting is a huge problem. But I also think, to your point, we can't just like throw everything out the window and say, well, I'm not going to diet and I don't care, I love myself and I'm just going to do whatever I want, right? Because then that's going to become a problem. So to your point, like this, having a plan, like having a lifestyle modification, having a, if you're going to fall to your, like, if you have no net and no plan and no like guardrails, you're going to just fall to whatever, right? And so you've got to have something in place. And so I completely agree with you there. Like it just can't be a free for all. So
yeah, I think Cassie, as you're saying, it's so important to embrace all body sizes, regardless of how much you weigh or what body size you are. We're all different and unique, and there has been, decades, generations long trend of what our perception of beauty is supposed to look like. And the perception of beauty is something that is completely subjective and should be subjective, right? And so embracing who you are at any shape, size, capacity is so incredibly important. You should be empowered to look and feel however you want. The message is really, okay, we're embracing ourselves as who we are, we're showing up and being authentically true to what we look like and what we want to look like. Let's also ensure that we are protecting our health as part of that, right? So whatever that looks like for you, and there's actually some really interesting research on the health at every size movement, and it really does show that people at larger body size can be quite healthy. And there isn't necessarily a one-to-one direct correlation between body size and health. And so you could have a larger body size and still practice healthy habits, have good nutrition, and really see some great shifts in chronic markers for chronic disease and cardiometabolic disease. And so there has to be, again, going back to personalization, there has to be this place where you are embracing and celebrating your unique individuality while also embracing and celebrating your health as part of that. And for some people, and for a lot of people, the majority of people, body size does impact, depending on the individual, body size can impact your health markers, right? And so we do need to focus on weight loss as part of your journey, but we don't need to focus on, 300-pound weight loss or hundreds of pounds weight loss. It's really, really, really individual. So,
right. And
it's
it
a
goes
hard
back
message.
to health markers. And I completely agree. Because I check a lot of labs on patients, a lot. And I have patients that, weigh 250, 300 pounds, but are healthy. Like they don't have high insulin levels. They don't, I have a patient I can think of who played football, like professional football, college football, and is a big guy, but he has really good health markers, right? And so that's great. But he also still follows a nutrition plan and works out. And so I think, again, to your point, personalized medicine, just making sure wherever you are, that you're making sure that the machine that you have, your body, is getting the proper things that it needs, and it's not giving you warning signs like high insulin levels and high triglyceride levels and high liver enzymes. And if it's not, then that's great. But I also think that health is a journey, and it's something I tell people health is not owned, it's rented, and the rent's due every day. So if you have great health markers today, that's perfect. But if you throw everything out the window and for a year decide, oh, I'm healthy, I'm just going to do whatever I want and not make good lifestyle choices, I promise in a year, your health markers are probably going to look different than they look today. Right. And so it's just like, and as you get older, it's more difficult. So I think that's an important thing too, at this movement of like no diets, whatever. Yes. Embrace yourself. Yes. I think all body sizes and types are beautiful. I just want people to be educated, because I will also tell you that I have some very thin patients. I have patients that weigh 100, 120 pounds and have terrible biomarkers, right? Like the skinny fat people. Oh my gosh. I'm like, this is bad. Like we have to fix this. Like, so I think it's just being empowered and knowing truly what's going on with your body and truly what's going on inside. And that's the interesting thing about people. Like we're kind of like books, right? You can't judge us by a cover. And I see that a lot. So you can't judge a book by its cover. You can't judge a person by their body size, but you need to know what's going on under the hood, what lights are on, and what you need to do to kind of keep making sure that you're becoming a better person, right?
Yeah, it's hard to prioritize our health when we have so many competing priorities in this life.
Mm-hmm.
But at the end of the day, it's the most important thing for us to prioritize, because, and people will say that when they have an accident or an injury, and suddenly they don't have access to the things that they used to have, like maybe they have to be on crutches, or they don't have the ability to make their own meals anymore, right? When you have that taken away from you, you really realize how valuable and important it is as part of quality of life.
Yeah. What's one more? So we have the oat Ozempic that needs to go. The anti-diet culture we think is good, but you should have a plan to do something to make sure that you're holding yourself accountable to just maintaining the health that you have or making sure it's not worse. What do you think is one more? What about protein?
Question.
Let's talk about
a lot of conversations about protein right now.
Yeah. So what's the truth about the myth on protein? Like, how much should we really be eating? I know what the medical literature says, but how much do you think that people truly need from a registered dietitian perspective? How many grams per pound does that change over time? Does it change when we go through menopause? Does it matter if it's animal protein versus plant protein? What are your thoughts on that?
Yeah, so this is probably one of the biggest topics in nutrition right now. I think people have always talked about protein, but they're talking about it more in the context of GLP-1 medications, because we know that GLP-1 medications for weight loss can actually cause additional losses in lean body mass, aka muscle mass. And so people are talking a lot more about protein because they're talking a lot about GLP-1. So let's break it down. So protein is a very critical nutrient. It's a macronutrient, which means that it contains calories, and the three main macronutrients are protein, carbs, and fat. So protein is especially important because it is really the primary macronutrient that serves as the building blocks of our tissues, particularly muscle mass. It's really important to have muscle mass, not just for #gains, but really important for health overall, especially when it comes to bone health and metabolism. So we want to ensure that we're eating adequate protein to support bone health, to support muscle mass, which supports bone health and also helps keep our metabolism humming, particularly as we age, and for women as we approach and go through menopause. So protein is also very well researched for its ability to make you feel full, which in the clinical world we call satiety. So protein is unique in that it helps you to feel satisfied or full, more so than carbohydrates, and a little bit more so than fat, but fat also helps you to feel full. The cool thing about protein is it also has a higher thermic effect of food, right? That means that when you consume protein, you're actually burning more calories to metabolize or break down protein than you are with fat and carbs. So, for all of those reasons, protein is a really, really important nutrient. I would argue all of the nutrients are really, really important. So, I wouldn't say that it's more important than carbs or more important than fat. I think, fats and carbs and protein kind of go through phases of being hot and not hot and kind of canceled or not canceled.
Yeah.
And protein is definitely hot right now. But there's a lot to talk about and unpack when it comes to protein, right? So we know protein is important, we know why, but how much protein do we need? So in nutrition, we tend to take things to the extreme. We have things like the carnivore diet where people are just only eating protein all day long. You're just eating animals and no vegetables, no produce, no carbs, just animals.
And their guts are terrible, by the way. Like their
correct.
Faecalibacterium is dead. Their Akkermansia is probably dead. All their good bacteria are in trouble because they need fiber. But go ahead.
Yes, exactly. Fiber is so important. Also, like carbs are breakdown to glucose. Glucose is the primary fuel source for the brain and our muscles. We need fuel for our muscles in order for us to work out. So there's a whole, and as you said, Cassie, when we talk about fat, we have to talk about it in the context of hormones. So all of the nutrients are important. Protein is not any more important than carbs or fat, but it is super important. It doesn't mean that you need to protein load and only eat protein. The recommendation, and this is super scientific, but I can break this down into something that's a little more practical in a moment. But the recommendations for protein intake are 0.8 to 2 grams per kilogram. So in medicine, which I'm sure Cassie has told you all, we use the metric system, which is not super helpful for anyone except people in healthcare. So for those listening who are not in healthcare, the way that you break that down is you divide your weight in pounds by 2.2, and then you get your weight in kilograms. And then you multiply that by a number ranging from 0.8 to 2. So where do you fall within that range really depends on your needs. So the typical quote unquote healthy individual is probably fine at 0.8 grams per kilogram. If you are physically active, if you are going through menopause, if you are elderly or senior, then you probably need something that's a little closer to 1.5 and sometimes 2 grams per kilogram. So we definitely want to make sure we're personalizing your protein needs based on lifestyle. Some people need a little bit less protein because they have a kidney condition. So the amount of protein that we eat does depend on age, hormones, lifestyle factors, but also really important to think about the type of protein that we're consuming. So we have two main categories: animal-based proteins and plant-based proteins. I come from the perspective that both are good. We know that having a plant-forward diet, so a diet that consists of mostly plants but not exclusively plants, can be really beneficial for health. And we can get protein from plant sources like edamame. We can get protein from legumes, so beans, all of the lentils, chickpeas, black beans, navy beans, all of the different beans are a great source of protein. And as you said earlier, Cassie, also really, really good source of fiber, which is super important for our gut health. So we can get protein from both plants and animals. When we think about getting protein from animals, we want to be mindful about personalized health. So the research on saturated fat is really dynamic and evolving and cool, but we used to just say you have to have low fat everything. You can't eat high fat or whole milk or high, like marbled meats and fatty meats, because we know that that's going to cause heart disease. Now, interestingly, the research is showing that in dairy products specifically, saturated fat may not be harmful to your your lipid profile. So particularly those fermented dairy products. So things like cheese and yogurt contain protein. They also contain saturated fat, but the saturated fat in dairy products might not be as harmful to your lipid profile. So we're learning a lot about the types of protein we should be focusing on. Generally speaking, we do want to minimize processed meats as part of this. There's quite a lot of research, although it is association-based observational research, that shows a correlation between high levels of processed meat and cancer risk. So want to ensure that we're having whole foods as much as possible and limiting animal proteins that are more processed, like your sausages and your bacon and things like that.
And lunch
I need
meat.
some water. That was a lot.
Lunch meat, right? Lunch meats, things like that. Yeah. So I talk to a lot of people who are like, well, I eat, lunch meat and sausage and, and I'm like, okay, well, those are processed meats. I would rather you eat lentils so I do think it's important for people to think about that. I think eggs are a great source of protein. I think the other thing you have to think about with protein though is where is your protein coming from, right? So ideally we're trying to get meats that are, pasture raised, grass fed. If you're feeding animals a bunch of corn and wheat that has all these toxins and chemicals on them, then that's a problem too. So it's difficult, but in general, you want to look for pasture raised, grass fed beef if you can, or, fresh caught fish. Or to your point, you just want to make sure you're looking for other sources of protein like beans and things like that. Just not all the processed stuff. There's so much processed meat out there, which also kind of drives me crazy with this plant-based meat that people talk about, right? These plant-based patties and all this. That stuff is so processed. Like
that's number 3, Cassie. That's got to go away.
I would rather you eat lunch meat than eat plant-based like soy patties, I don't know. It's just... But I think that's a good recap, like thinking about the type of protein that you're getting, thinking about your age, your hormones, your lifestyle, and then making sure that it fits you. And I think the best way to do this, what I tell people, is to track it, right? We do in-body scans on all of our patients. So let's follow your muscle mass when we change your diet over 4 weeks, 6 weeks, 8 weeks. And if you are drastically losing muscle, then we have a problem with either you're not consuming enough protein and or you're not doing enough resistance training, or maybe you're just not consuming enough calories in general, right? So tracking it is really important, and tracking it not just with a scale though, because a scale tells you nothing. It's almost worthless. Like I think if you want to talk about a vital sign that needs to go or a medical piece of equipment that needs to go, it's a regular scale because it tells me nothing. Okay, great. Perfect.
Not super helpful.
Yeah, I mean, you weigh 130 pounds. That's like telling me your cholesterol is 300. You can have a cholesterol of 300, but actually be very healthy if you've got really good LDL cholesterol, like, big particle size instead of small, and you've got great HDL and your triglycerides are low. So that tells me nothing. Same thing with a scale. You're 130 tells me nothing about you. So I think that's important too. And you brought up fats, and I think that's really important to kind of talk about as well. There are these people out there that say like, eat all the fat you want. Fat is good as long as it's olive oil, as long as it's peanut butter and it's almond butter and it's, avocados and it's nuts and seeds. You can have all the fat you want. I don't know that I'm on that train of all the fat you want. Like, if you're having 200 grams of fat a day, we got a problem probably. But what is your thought on that? Like, you need fat for sure to make hormones, to make sure your brain's functioning. But is there amount of fat that's too much? If we're eating good, healthy fats, obviously if we're eating bad fats, it's a different story. But what are your thoughts on fats?
Yeah. So in the context of good, healthy fats, I think the dose and the portion just depends on your individual goals. If we're overdoing it on the fats, we might find that we've got some GI concerns related to that, specifically diarrhea. So if you find that you're loading up on the fats and you're having looser stools, it's probably from the fats. So fats can be challenging to digest. We require a few different organs to help break down fat. And it can be a little bit taxing on our gallbladder. If you're someone who either doesn't have a gallbladder or is prone to gallstones or sludgy gallbladder, then it can be a little bit harder for you to break down those fats. So you want to be mindful about digestion. If your goal is weight loss, we also want to be mindful about how much fat we're consuming. Again, we're not eliminating fat. You could absolutely have olive oil, you can have avocado, you can have the healthy fats, but we do know that fats have over double the amount of calories per volume compared to protein and carbohydrates, which means that for the same size, you're getting double the amount of calories. So a itty bitty tablespoon of olive oil has 120 calories, whereas, a tablespoon of vegetables or protein has probably half, if not a quarter of that. So if you're having more portions of fat and you're trying to lose weight, it might increase your calorie intake overall, which might make losing weight a little bit more challenging. So those are my big concerns with overdoing it on the fat. Mostly digestion, and if you're trying to lose weight, it might be a little bit harder for you to lose weight by having a high fat diet. Unless you're doing keto, which is a whole nother conversation that we don't have to talk about.
Yeah, I don't think we have time to talk about that.
Yeah, we need 2 hours for keto.
And then carbs. So, a lot of women, especially my age, your age, like, 30, mid 30s, late 30s, 40s, a lot of women have this mindset about like carbs are bad. And that's the number 3 that probably needs to go. Carbs are not bad. It's the type of carb, right? So like if you're eating good, nutritious carbs, if you're eating vegetables, if you're eating, sweet potatoes or rice in certain amounts, assuming that you're exercising, like the carbs aren't bad. Like you need carbs to sustain you. I know all the keto lovers out there will love that. But I mean, I truly think that you need some carbs to sustain you, especially if you're lifting heavy and you're, doing exercises and things like that. It's the type of carb though, right? Just like the type of protein. And so I think where we get our wires crossed is like, we don't want people having 200 grams of processed carbs in a day because that has a lot of extra sugar and it doesn't have fiber. So they've stripped the fiber out of those carbs and they put sugar and crap in there that when it leaches into your, bloodstream, because your gut has lots of holes in it, you're going to have issues. You're going to have immune complex issues because there's things in your food that shouldn't be in your food and they definitely shouldn't be in your bloodstream. So it's just like the type of carb, right? And so I think a lot of women have this in their mind, like, oh, what, carbs are bad. Carbs make me fat. Carbs make you gain weight, which is not true if you eat them correctly. And actually, if you undereat carbs and you are, lifting and trying to lose weight and you're really severely undereating carbs, eventually your hunger is going to get out of control and then you're going to overeat because you're going to have to make up that difference in fat, which you just said is not good, because when you start making up the difference in carbs with fat, you're going to overeat fat and then you're going to have too many calories. And so it's just, I think that's one thing that women really get wrong is like carbs aren't bad. You just have to eat the right amount of carbs and you have to eat the right types of carbs, right? So vegetables and good carbs are different than processed carbs.
Yes, totally. So the 3 macros, protein, carbs, and fats, are all important, and they all have so many nuances, right? And just after 1 hour of chatting with Cassie, you could see why people are confused, because everything has to be, when we talk about nutrition, we have to talk about it in the context of individualization and personalization, right? And we also do a lot of stuff to our food that impacts the way that we metabolize it, which ultimately impacts our health. And so carbohydrates are really the body's primary fuel stores. They get broken down into glucose. Glucose fuels our brain and it fuels our muscles. and we need fuel in order for us to function. So carbs are not bad. They're actually really, really good and very important. We can sort of shift the way that we metabolize energy with ketone bodies from fat, but we're still relying on carbohydrates. And that's also not the body's natural state to be in ketosis primarily all the time. So we can go in and out of states of ketosis for some folks, but generally speaking, we really need and require glucose or blood sugar for us to function. We can get carbohydrates from so many different sources. There's probably carbs in almost every food type that you can think of, except for pure animal protein and pure fats. But there's carbs in milk. There's carbs in beans, in vegetables, in fruit, in grains, in starchy vegetables like potatoes. There's carbohydrates in almost all foods, except for those ones that I mentioned. And we want to focus on whole food sources of carbohydrates because they have more fiber, they have more micronutrients, which means that they have more of those antioxidants, which help us to, fight inflammation. They have all of the vitamins and the minerals, which all play different functions and roles in our body, but are essential. Many vitamins and minerals are essential, which means that we have to get them from food. We can't create them in our body. And so it's required that we eat food in order for us to meet our needs. So really important to focus on whole food sources. You can really get them from anywhere. Rice is not bad. Potatoes are not bad. We want to focus on the right amount, high fiber options, and they'll make you mentally feel really good too. So the thing about carbohydrates is they really help to produce serotonin in our brain. That's why we all kind of get happy when we have carbs. So I found in my practice that when we're going on a lower carb diet, it can cause shifts in mood, can also cause constipation, as Cassie mentioned earlier, where you're having less fiber, which can be really, really challenging for your microbiome. A lot of negative health impacts with eliminating carbohydrates. So carbs are bad, needs to go away. Carbs are not bad. Carbs are great. We got to have the right type of carbs in the right amount, just like with protein and just like with fat.
So I kind of want to transition and take a few conditions that a lot of people that listen to this podcast have. And I want you to give us like a 1 to 2 minute synopsis of what you would think would be a good a good nutrition plan, or like things for these people to do to kind of help with that disease process, right? So like, should they be more focused on protein? Should they be more focused on good, healthy fats? And it may be that all these things end up being the same. Because what I find is that I tell patients in general to follow somewhat of like a Mediterranean type diet typically. Now, every now and then, depending on the person, they may need more protein. But like, also, are there any foods in particular when I say these disease processes that you think, oh, these foods are very beneficial to these people because fill in the blank, right? So the first one I want to start with is PCOS, which we know for listeners, if you don't know, PCOS is not only a hormonal issue, but is a huge metabolic issue. And that's why it's not treated right in this country. It is an issue where your hormones are out of balance. Typically, you have more testosterone than most people, most women. And a lot of times you'll have something called estrogen dominance, although not always. And so you have issues with irregular menstrual cycles. That the increased amount of testosterone causes a lot of things like acne, oily skin, and things like that. But the other problem you get with PCOS is a huge metabolic issue where that excess androgen causes increased insulin resistance and causes increased insulin issues, so that people start to gain weight. They have high cortisol levels, and it's this big mess of a cycle that the insulin drives the high insulin and high cortisol drive higher testosterone, and the higher testosterone drives higher insulin and cortisol. And all of this drives irregular menstrual cycles, which then the lack of estrogen and progesterone in your gut cause issues with your gut, which further cause the androgen issues and the insulin issues. And so it's kind of a big mess. And the way that we treat it in this country is we give people birth control, which just masks the symptoms and doesn't fix anything with the actual disease process. And we don't talk to people about diet, because why in the world would we do that? And so then 10 years later, when they get off birth control, they've just gained weight for 10 years. Now they're infertile, and they still have the same issues that they started with. And so we're back at square one. So,
Yeah, catastrophic, right? Having
with that
PCOS
being
is
said,
very hard.
and there's not a lot of good information out there. So is there something you think of with PCOS, like this is the diet for you? I tend to talk to people about maybe a little bit lower carbs in that case, where it's like 30 to 40 per meal, but it's good complex carbs, and trying to limit sugar. Is there anything that you think about though with PCOS?
Yeah, so when we think about PCOS, as you said, Cassie, we know that insulin resistance is really important, even if you have this PCOS prototype that's like so-called lean PCOS, where have your BMI is within the quote unquote healthy range. We still are seeing insulin resistance within this patient population. So whenever insulin resistance is present, we want to make sure we are very mindful about carbohydrate intake. Again, doesn't mean we need to avoid carbohydrates. Research shows, there's not a large body of research on this, but research shows that women with PCOS would benefit from having a moderately low carbohydrate diet. So not keto. When we talk about moderately low carbohydrate diet, we're looking at, when we think about it in terms of macronutrient distribution, we're looking at around a 40% of your total calories from carbohydrates, sometimes as low as 30%. So 30 to 40% range. What that looks like in practice is maybe you're having one starch-free meal a day, or you're having a quarter cup spread throughout your meals, instead of having, two cups with 2 meals a day. So there's a lot of different ways that you could decrease carbohydrates to get to that point, but you can still have rice, you can still have grains. You just want to be mindful about choosing options that are higher in fiber, because if you have high fiber foods, it actually decreases your overall net carbohydrate, because fiber is non-digestible by humans, and so it actually doesn't contribute to calories overall. So that's one component with PCOS. Also want to be mindful with those refined, highly processed carbs, because they're just have more carbohydrate overall and are pro-inflammatory. So be mindful of your sugar intake, your intake of refined carbs that are typically white in color. Also want to be really mindful about inflammation. Anytime we talk about insulin resistance, we have to talk about inflammation as part of that dialogue. But PCOS in particular, we know that we tend to see higher levels of inflammation. So focusing on anti-inflammatory foods, like lots of vegetables, variety of different color vegetables, absolutely can have fruit. We want to add those healthy anti-inflammatory fats like olive oil, avocado. You could add things like garlic and onions and cinnamon. Those are all really powerful anti-inflammatory foods as well. So focus on moderate carbohydrates and adding in lots of anti-inflammatory foods.
Okay. And what would you say about menopause? I would say that is very similar with menopause, or as we kind of transition into that perimenopausal phase, with the exception of also increasing protein a little bit. But I'm interested in your thoughts.
Yep. My thoughts exactly. That's really what the research shows. We know that also insulin resistance tends to be something that we see in women in perimenopause, through menopause. So want to be mindful of carbohydrates. Overall, we know that women in particular will see losses in bone mass. So want to make sure that we're focusing on protein to help to support healthy bones, and also support building of muscle mass to help with our natural decline in metabolism, unfortunately, that we all face. So yes, very similar, with the added caveat with protein.
And then what about infertility? Do you have any sort of tips or tricks if people are suffering with infertility, as far as from a diet perspective? The things I think about are you eating enough in general? Are you getting enough carbs, enough protein, enough calories, enough fat? Because if you're not eating enough, obviously that triggers issues with your menstrual cycles. And so if the answer to that is yes, then my next thought is a PCOS type picture with insulin resistance, which we've talked about. But is there anything else you think? Yep. Which we're going to talk about next. But is there anything that you think of as far as infertility, like certain things people should eat in particular?
Yeah, I think when it comes to infertility, there's so many different root causes. So it really just depends on what the root cause is. As you said, Cassie, for a lot of women, it's PCOS. Some women, it's Hashimoto's, which we'll talk about in a minute. But ultimately, really important to ensure that you're having adequate calories, you're not under eating. Stress is also a big component when it comes to infertility. So we work a lot with our patients on the lifestyle component. Managing stress, trying to conceive has become a really challenging journey for a lot of women. And so there's a lot we can do from a nutrition perspective to make sure that we are supporting our hormones. So, for example, making sure we're not going for long periods of time without eating. When we go for long periods of time without eating, our body goes into fight or flight, which increases cortisol, our primary stress hormone, which increases inflammation and can have a really big impact on your ability to conceive. So not skipping meals can be really, really helpful as well with this population.
So then I want to talk to you about hypothyroidism and like Hashimoto's. Talk to me about that. So the things I think about with this are a lot of people with autoimmune issues some of them have dairy intolerances, some of them have gluten intolerances, some of them are just wildly inflamed because they have issues with insulin resistance and things like that. So do you have any particular dietary advice you give people with Hashimoto's or hypothyroidism?
Everything that you mentioned, absolutely. Also want to think about some key micronutrients like selenium and iodine. So selenium is a really powerful micronutrient that is really important for thyroid health. And when we think about thyroid, we want to make sure we're starting with food first and really not focusing on many supplements. We can certainly explore if a patient is a good candidate for supplements, but want to start with food first. So with selenium, you could actually get all of the selenium daily value that you need of selenium in a day with one Brazil nut. So that is like a fun, quick, and easy thing that anyone who has Hashimoto's, or if your thyroid hormones are off, you can always add one Brazil nut a day. It's not going to be harmful. If anything, it'll be helpful. So that's a quick tip that's really fun to talk to people about. With iodine, we know iodine is really important for thyroid health. We need it, but also too much of it can be harmful to thyroid health. So making sure that we're not taking any supplements with iodine in it unless there's a clear iodine deficiency. But you could also get iodine in your diet naturally through things like seaweed. So those little sea snacks or sushi can have some seaweed on a more regular basis to ensure that you're getting adequate amounts of iodine. We also iodize salt in our country, but a lot of people don't eat iodized salt anymore because we've moved more towards like sea salt, which is not iodized. So you can also have iodized salt as part of that to be able to meet your needs. So those are some additional thyroid things, but inflammation is really big with this patient population. We want to make sure we're doing a lot of anti-inflammatory foods.
And then hyperthyroidism, so that's the opposite, Graves' disease. I have people who reach out to me about that. That's going to be one where you're going to kind of want to maybe limit iodine. And this is where it's tricky with hyperthyroidism. You have to check levels. And so you have to know, are you somebody who has high iodine? I wouldn't recommend taking a lot or eating a lot of iodine with hyperthyroidism because that can exacerbate that condition. But is there anything different you think about with hyperthyroidism versus hypo? I mean, it's another inflammatory process. So again, a lot of anti-inflammatory foods, but anything else you can think of?
Those are the basics with hyper.
Mm-hmm. Okay. And so I think, to kind of sum it up in general, like you said from the beginning, nutrition has to have an individualized approach. It has to have your goals in mind, and it has to be sustainable for something that you can do for a long period of time, because we have to eat every day for the rest of our lives. And so working with someone and getting an individualized plan is really important, and a plan that you can follow and sustain, but also a plan that is good for your body based on the biomarkers that you have. And I do think there's a lot to the genetics of nutrition as well. And some people do better with lower carb and higher fat. And, that's a whole nother episode too. I have a friend who just wrote a book about this, about the epigenetics of obesity, which is fascinating, and diets. But just making sure that you're finding someone to work with to help you through this. And then remember that it's a journey. It's a process, and it's something that you have to work on every single day, no matter how good you get. It's something that you have to keep refining and retweaking and reprocessing, because as we age, things change too. And so I think that is what's important. And then just finding someone that you trust and following them, and trying to get information from them instead of just typing in Chat GPT or Googling things. You need to find someone with credentials that know what they're talking about. So I want to kind of transition to the final 3 questions that I ask everyone on the podcast. And so don't overthink it, but I just want, just first thing that comes to your mind. The first question is, what is one food that is most beneficial and why?
One food that is most beneficial and why? I would say there's so many. This is a hard one. Something green. So if you could eat something green, something naturally green, you're probably covering a lot of bases with vitamin K. You're covering some bases with minerals like magnesium that are really important, fiber, and it's one of those key colors that we know is beneficial for chronic disease prevention. So that's my cheat answer.
Anything green. So I actually have a little bit of green juice every day. My friend Nicole McPherson is all about the green juices. And so I have these organic green juices that are fresh pressed and whatever delivered to me. And so I have a little bit of green juice every day. And I will say it's interesting. Like, it's helped my stomach. It's helped a lot of things. So I would agree with that. I think it has like parsley and kale and cucumbers, and there's a bunch of green stuff, spinach, all sorts of stuff in there. But it's good.
You just named 5 vegetables that are green. So
lemon, I think there's lemon in it. Yeah, all the things. Okay.
And you don't have to juice it. If you juice it, you don't have the fiber benefits, but
correct. Well, this is juiced some special way where they still have the skin too, so it's supposed to have the fiber. I don't know. It's a whole thing.
Nice.
Yeah, it's a whole thing.
Send me a link.
Yeah, I will. I can definitely do that. I think it's called Alchemy Organics. It's based out of Austin. The lady who started it had thyroid cancer and was really sick, and so I get this little guide, and it tells me how she juices it and how she recommends, but she uses the juice and the pulp and all these things. It's like a whole 3-step process.
I love it.
Interesting. So the next question is, what is one thing that anyone can do that's completely free that will benefit their health?
Completely free. Go for a walk.
Okay.
It's not nutrition related, but yeah, anyone could go outside for a walk, and we know that there are a tremendous amount of mental health benefits associated with spending time outdoors, and then of course the physical health benefits from a metabolic perspective. But yes, go outside, go for a walk.
Yeah, of the 50 plus episodes that I have recorded for a podcast, I would say at least half of them have to do with walking. And so I think that's one thing that's just so underutilized and underappreciated, is being outside and walking. So the last question is, what is one thing that you wish you would have known about your health 20 years ago that you would have done differently now?
I think 20 years ago, I probably would have eased up a little bit and been a little less rigid. I think flexibility is something that I've learned as I've gotten older. I have a small child. I have a startup. It really forces you to be flexible in life and also in food, and really embrace the nuances that we talked about in this podcast around what to eat, when to eat, how much to eat. So really embracing food for its flexibility. We're very lucky to have the amount of access that we do to food, and get excited about that instead of stressed. It's something I would have done differently.
Yeah, I completely agree. I think that we forget in this country we have the luxury of having access to too much food all the time. And so that decision fatigue of oh my gosh, what's for dinner? What am I going to eat for breakfast or lunch? A lot of people don't have that luxury. So then yes, being flexible with yourself and finding, whole nutritious foods that serve you and make you feel good, and just having a better relationship around food in general is something that just people have to work on. So I like
We're
that
here to help
answer.
you. We're here to help you.
So, Tamar Samuels, thank you so much for joining me on this episode. We'll make sure and link all your stuff in the show notes. If you guys enjoyed this episode or you found anything in it interesting or beneficial, please make sure that you share this episode. Make sure that you like and follow us on wherever you find this podcast so that you get the episodes every week. And then join us next week on the next episode. Wow. I don't know that you could have packed any more tips into a single podcast. I hope that this podcast was informative and helped you answer some of your questions about nutrition. If you found anything in this podcast helpful, please, please, please share it with someone that you know. I know you can think of someone that needs to hear this podcast that's asked questions or been struggling with nutrition or weight. So please make sure that you share it. Make sure you're following us anywhere that you get your podcast. If you follow us, you'll make sure that you get every single episode that is released, because we may start releasing bonus episodes, not just on Sunday. Make sure that you leave us a review as well, please. That helps me know that I'm doing what you guys want me to do, and I'm interviewing the people that you want me to interview. Follow me on social media. Let me know who you want me to interview and what you want to learn about. And lastly, please remember Modern Endocrine now has a license in 39 states. We would be happy to see you virtually if you're in one of those 39 states for any medical concerns you have, including weight, gut health, anything like that. If you are somebody who needs some nutrition help, we have a very good functional medicine nutritionist as well. And typically we can do that in any state if it's just nutritional help. Make sure that you join us next week on the next episode of Hormones, Metabolism, and You. I hope that you have a wonderful week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.